Good afternoon, everybody. Welcome to our fifth and final session on our reproductive health convening here at West Virginia Free. My name is Sarah Harris. I'm the Director of Programs. And with us today, we have our largest panelist yet, and we're going to be talking about LGBTQIA plus health here in West Virginia. We have with us today Ash Orr, Isabella Cortez, Danielle Maness, Layman, and Sarah Hutson. We have a lot to get through, and we're going to try to be respectful of your time. So we're going to just jump right into this. And if you have questions at any time during this conversation, please just drop them in the chat. We will take questions after each presenter. So without further ado, let me set the stage for our first presenter, Ash Orr.
Hi, everyone. My name is Ash Orr. My pronouns are they, he, and I'm involved in a couple of different organizations here throughout the state. Today I'm going to talk to you all primarily about the impacts of these reproductive healthcare bans that are having on the trans community. So I'll be starting out with, as we've seen, there has been a continued surge in anti-trans legislation across the country over the last few years. In 2023 alone, we saw over 500 bills introduced, again, across the country targeting LGBTQ plus rights, and over 400 of those bills targeted the rights specifically of the trans community. And close to 150 of these bills specifically aim to restrict access or to outright ban access to transition-related healthcare. And it's important to note that this legislation has been based on fear-mongering, misinformation, to simply exploit the public's relative unfamiliarity with trans people and trans rights. But again, I'm going to be primarily focusing on the impacts this is having for trans individuals seeking abortion and other reproductive health care. So the Williams Institute of the UCLA estimates that there are at least 1.6 million trans people ages 13 and older in the United States. And trans people exist in all races and backgrounds, and we live all across the country from urban areas to rural areas. But the highest concentration of trans people in the United States live in the South, which is also where some of the most stringent abortion restrictions or bans are in place. But while some of those people who are seeking abortions will go out of state, others, especially Black, Brown, Indigenous, low-income individuals, are often left with zero to few options, including not being able to cross state boundaries. And these are individuals who are also more likely to struggle with poverty and job discrimination, and many lack the financial resources to cover abortion procedure or the ballooning cost of travel. And as of 2015, nearly 1/3 of all respondents to the U.S. Trans Survey, which is the most in-depth examination of trans life in the country, were living in poverty. That's more than twice the rate of the rest of the country. So it's important to note that discrimination within the healthcare setting goes past abortion care. We know that few trans men and non-binary patients, for example, regularly get Pap smears to screen for cervical cancer on time. As for one example, only 27% of trans respondents to the 2015 U.S. Trans Survey did so within that previous year. And while Pap smears are thankfully not as stigmatized like abortion is, this data shows that when a procedure gets coded as being for one gender only, that it's just wrong. That doesn't describe the people who get that service, that it ends up influencing those who obtain that care. And what's also concerning is we are seeing threats to medication-based abortion and other self-managed options that are impacting trans and non-binary individuals. Since the overturning of Roe v. Wade, in addition to these bans, there has been other medical services put at risk. Whether trans men or non-binary patients are seeking an abortion or primary care, local independent abortion clinics or Planned Parenthood are often the only places, especially outside of major cities, to find transition-related health care and abortion access. So losing gender-affirming care in clinics that are forced to close or losing access to mutual aid organizations operating through Plan C are impacting our community's access to abortion care and other reproductive health care. Another issue that we're running into is the lack of telehealth services. So for those of us here in West Virginia, I know we can all relate to having internet issues, and especially during the first part of the pandemic, a lot of us relied on telehealth services. And we are seeing now attacks occurring on telehealth. We are seeing restrictions being put in place, and a lot of individuals in rural areas are losing access to telehealth services. And this is directly harming trans people residing in rural regions or healthcare deserts, which West Virginia also struggles with. Rural trans people are also 3 times as likely as all trans adults to travel between 25 and 49 miles just for routine healthcare. That includes basic reproductive healthcare checks. So in addition to all these attacks that we are seeing on abortion access and reproductive healthcare, a lot of folks who were relying on telehealth, we are just seeing this huge gap being created. And the reality is access to telehealth helps to lower income trans individuals and families obtain transition-related healthcare. That includes abortion access. So it's easier to access for those with disabilities as well, those who lack transportation or for safety concerns. So a lot of folks right now are very concerned as we go into the next legislative session, seeing these potential attacks on not only losing access to basic healthcare, but we are seeing access to telehealth being ripped away as well. So in terms of like what can be done to better protect individuals who are in these settings, the reality is that we need to be offering more services for rural trans individuals. Rural trans individuals struggle to find doctors who are capable or willing to offer abortion access. And we're very lucky to have Women's Health Center here in West Virginia who is stepping up to fill in that gap, be it with their services in Charleston or their new center over in Maryland. We are also just simply needing better education around abortion access for trans individuals. Often it's forgotten that there is an intersectionality between LGBTQ justice and abortion liberation. So if we can combine those two intersectionalities, we can see that we just need to be working on these issues and make sure that folks have access to the important healthcare that they need to be able to obtain. That is all I have for right now, but I'm more than happy to answer some questions. I know that was kind of quick, but I just don't want to take all the time here. So yeah, I'm happy to answer any questions that folks may have.
Hey, Ash, how could people get in touch with you if they have questions after this conversation?
Yeah, absolutely. And something I should have stated too is I do a lot of work outside of the organizational work that I do. I do a lot of Plan B runs throughout the state. I am also happy to help folks get to their medical appointments or find them ways to obtain transportation to get to their appointments. So if folks want to reach out to me, I am active on Twitter or X, Instagram, and you're also welcome to message me on Facebook. I don't check that as frequently, but I strongly encourage folks to reach out to me on Instagram. I do get those notifications pretty quickly. I am more than happy to answer any questions, provide resources, or step in wherever I can to assist you.
Thank you so much. All right. Well, I don't see any questions in the chat at this time. So again, Ash, thank you so much. We know that you have a very busy schedule today, and we're just so thankful that you could join us today and share that information and insight.
Thank you.
All right. So our next presenter is Isabella Cortez with Fairness West Virginia. Isabella is the Gender and Policy Manager. Let me get everything situated and we'll welcome Isabella to the stage.
Hi, everyone. My name is Isabella Cortez. My pronouns are she, her, hers. And Ash did a fantastic job about talking kind of broadly what's going on in the country. He did a lovely job. I'm going to talk a little bit more about what's happening in West Virginia specifically. But first, I really do, I think it's really important to talk about how, like we were talking, how Ash was talking about how, a lot of, trans men and non-binary people are less likely to get pap smears. We actually do have data for West Virginia specifically about trans people and the barriers and obstacles they face when it comes to getting healthcare, any kind of healthcare, right? So that could be reproductive healthcare, that could be transition-related healthcare, that could be general primary care physician type healthcare, right? So we Fairness West Virginia conducted the West Virginia Transgender Health Study in 2019, and we did an update in 2021. And what we did is we surveyed transgender West Virginians and former West Virginians about their experiences and perceptions of healthcare providers and their level of competency when working with LGBTQ people and particularly trans people within the state. One of the interesting things we found was 3/4 of the respondents were between the ages of 18 and 35. So the state of healthcare for trans people, it skews really young. And we also asked, like, what kind of transition-related healthcare would people want to access? And it turns out the vast majority of trans people that took the survey, over 80 some, I think 86% of respondents either were currently receiving transition-related healthcare or would like to receive transition-related healthcare. And we did not include talk therapy. We were taught that was all medical interventions such as gender-affirming hormones or surgical interventions. And what we found either lined up with or was a little bit higher when you compare it to the national level. So we discovered about 60% of trans people, when they go get healthcare, they experience intentional misgendering. And that is simply, that's not someone going, oh, I used the wrong pronouns because I didn't know, or I just messed up. It was, I'm not going to use your correct pronouns. I'm not going to refer to you by the name that you go by, even if that is your legal. We actually ran into situations where trans people had legally changed their name, and people would, healthcare providers would refuse to refer to them by their actual current legal name, and wouldn't, and they were like, well, what was your birth name, right? So even when it was a legal change, there were some healthcare providers who were not on board with it. About 13% reported having unnecessary procedures performed on them due to being trans, and that could have been anywhere from having their blood levels tested by someone who had no business really going into that, because they came into the office, the doctor's office, with like a sinus infection or a strep throat, and they were like, well, let's test your hormone levels just in case, or because I want to. And they're like, a lot of the people were like, we already have an endo that does that. And so it was an unnecessary burden on them because that costs more money, right? And the most egregious example was someone went in for, I believe they ended up testing positive for flu, and they were subjected to a pelvic exam. So I'm not a medical provider. I know Danielle is a medical provider, but and you can correct me if I'm wrong, but I don't believe that the respiratory system and the genitalia are like connected at all. Like, I just don't think there's any need to do a pelvic exam for any sort of respiratory issue. So yeah, that was something that over 1 in 10 people reported having, like, some form of unnecessary procedure. 1 in 5 were refused healthcare outright by providers, and then about 2/3 of people delayed care either due to financial concerns or fear of discrimination, or just went without care entirely. And as Ash has already said, we have a lot of rural West Virginians, a lot of rural trans people here in West Virginia, and that means that about a third of people who responded to the survey said they had to travel at least an hour or more to receive healthcare. And that isn't necessarily, trans-related healthcare, transition-related healthcare. That's not necessarily gender-affirming hormones or anything like that. It was to see a doctor for anything. Some people said they had to travel for more than an hour. So the state of healthcare in this state is not the best. We have some, like the Women's Health Center, a couple, there's a couple places elsewhere that do great work. But generally, we are looking at kind of a transgender healthcare desert in the state. It is getting better, but it's still not great. And now, to shift the focus a little bit, I will talk about the relevant policy and laws, especially as it relates to abortion care and reproductive care specifically. So after the Dobbs decision, where Roe v. Wade was overturned, the West Virginia legislature called, I think it was 2 extraordinary sessions. The first one, they did not manage to ban abortion, but in the second one, they did pass HB 302 in September of 2022, and that does ban all abortions in the state, with the exception of if the fetus is non-viable, it's an ectopic pregnancy, or there is some sort of medical emergency, right? A medical emergency is not, it's a bit nebulous, right? So a lot of doctors are going to be, even in an instance where it's like, this is a medical emergency, we've seen reports from other states where doctors are like, we can't operate, we can't do, we know it's going to progress to a point where your life is going to be in danger, but we can't actually provide any care for you until it gets to that point, right? And there are some unique effects this has on trans people. So trans men, for instance, a lot of trans men take testosterone therapy for to alleviate their gender dysphoria. And some of the unintended consequences of this is if a trans man is taking testosterone therapy, one of the indications for pregnancy is that you should not be taking testosterone therapy while you're pregnant. It's generally accepted that it can cause issues, it can cause complications, right? So, doctors here, if you perform an abortion in West Virginia, if you're the doctor, like, you can face serious consequences. So we haven't heard any reports of this. I'm not saying this has happened to our knowledge, but there are doctors out there who, if a trans man gets pregnant, may not be willing to continue that testosterone therapy until the pregnancy, until they've either, given birth or they've gone out of state to get an abortion, right? Because they're like, the West Virginia law could interpret me giving you testosterone therapy as trying to, what's the word I'm searching for here? Try to kind of induce an abortion, right? And I could get in a lot of trouble, even though, like so there's been a lot of instances in other states where doctors have been afraid to administer certain kinds of care. And while we haven't seen it in West Virginia yet, I'm sure there's going to be some instances where a doctor might withhold gender affirming care during a pregnancy for fear of getting into legal trouble, right? Another bill that passed in our state this year was HB 2007, which is a gender affirming care ban for minors with exceptions. It doesn't take effect until January 1st of this coming year. So gender affirming care for minors is still completely legal in the state of West Virginia. And after it takes effect on January 1st, there are exceptions for severe gender dysphoria carved into the bill, right? And that is not robustly defined. So this also goes back to, as Ash was saying, how, rural West Virginians, rural trans people don't have access to all of the resources that, other trans people in other states might have. So this makes it harder because you have to travel to a doctor's office to get your letters. You have to get 3 of them, right? Because you can't do it over telehealth. You have to find a doctor, you have to find the correct primary care physician. You have to do all of these things, and that's going to reduce access. So even though it's not banned, a lot of trans kids are not going to be able to get the evidence-based medicine and healthcare that they need because of this law. We've also started to see some local drag bans. I believe Jefferson County, I'm sorry, a county in the Eastern I feel really bad for not knowing. A county in the Eastern Panhandle and also Putnam County have banned public performances of an adult nature. It's not a drag ban directly, even though it's intended to, it's a symbolic ban. But kind of the goal here is they are like, we're going to do as much as we can within the bounds of the law and wait for some kind of court decision to let us do more. But the purposes of these bans are really just to kind of scare LGBTQ people, like out of existence, right? So, for instance, we've seen a lot of drag bans in other states. And I think one of the drag bans in our state at the state legislature this year that didn't go anywhere, but one of them was worded in such a way that, like, if you were dressed in the clothing designated for the other gender, like that could be, I think it was a misdemeanor, right? And a lot of trans people, a lot of trans kids, a lot of trans adults are worried that that means they can't go out in public, right? Because they don't know exactly how that's going to fall, like what the legal, what the ruling would be, right? So these kinds of laws are designed to kind of scare LGBTQ people, in particular transgender people, just into the closet and out of existence, right? These are the laws that have already passed. What we are looking out for in the coming years, and again, we don't have any hard evidence that this is what they're planning to do. This is just taking a look at the national scope and going, we're making some informed guesses here. So please, after this presentation, don't run and scream like, oh my God, they're coming for IUDs or anything. Like we don't know that for sure. But something that we are looking at is they are likely at some point in the future to attempt to restrict access to contraceptives. And that also has a lot of implications for trans people, because one of the side effects of gender affirming hormones for trans women is reduced sperm count. So that could be looked at as a form of contraception, right? So this has all sorts of weird kind of ripple effects on people's access to healthcare, even when it's not directly related to abortion, right? We are also looking at a potential abortion ban with no exceptions. I know one was introduced this year. It didn't really go anywhere, but I'm sure they're going to try to do that again. We are also looking at potential gender-affirming care bans for adults, or heavily restricting access to gender-affirming care for adults. like removing removing Medicaid coverage, et cetera, right? We're also looking at some statewide drag bans and book bans. They haven't really gone anywhere. They don't really have any legs yet, but that is something that we are going to be looking at in the near future. And I've talked a lot more than I should have, so I'm going to be quiet and let Sarah. I'm going to let Sarah take over.
Well, thank you so much for that. That was really, really great. Lots of information, lots of things to kind of sit with. And there was a comment, it's from Katanya Hart, asking how do we get a copy of the slides? So I would be more than happy to email that, or Isabella, would you like to email that?
If you want to, if anyone wants these slides, if you just want to shoot me an email and can I put it in the comments?
You can put it,
I'll just put it.
You can put it in the comments, yeah.
Okay, I will put it in the comments, and then yeah, I'll just put my email in the comments, and you can email me, and I will send it to you.
Great. All right. Well, I think we'll just move right along here. Thank you so much for that, Isabella. I learned a lot. I know our audience did too. So next up, I think we're going to bring Danielle and Allie from Women's Health Center to the forefront. I'm not sure how to do a split screen here for y'all. So what I'm going to do is I'm going to bump us out and give it to you all.
Hey everyone, my name is Danielle. We're from the Women's Health Center of West Virginia, and I'm the medical director as well as a board certified women's health nurse practitioner, certified nurse midwife, and an acupuncture detoxification specialist. Do you want to introduce yourself first, Allie, before I go into a little bit about our history as a clinic?
Sure. My name's Allie Layman. My pronouns are she, her. I'm new to the Women's Health Center of West Virginia, WHCWV. I've been in this new LGBTQIA plus health coordinator position for about 4 months now, and I'm super excited and very, very thankful for WHCWV identifying that there are needs and gaps within LGBTQ healthcare, and for them to take steps to have a facilitator, liaison, resource gatherer to be in this position. So take it away, Danielle.
Yeah. So the Women's Health Center of West Virginia, we were originally opened in 1976 and provided only pregnancy tests and abortion care in the first trimester. In 2001, we actually moved to our current location, which is on the west side of Charleston, West Virginia, 510 Washington Street West. And as Isabella was speaking to, we all know that a year ago, essentially abortion was banned in the state of West Virginia. And as of 2 days ago, our sibling clinic, which is the WHC of Maryland, opened on Wednesday and is now providing medication abortion at this time, and we'll expand those services as well. Our mission really at the WHC is to provide inclusive and non-biased patient-centered care. The clients that we serve, we identify that they are the experts in their own health and well-being and their medical needs, and they lead their healthcare. 2 years ago we started evaluating what our community needed, and that's whenever we realized that even though we're in Charleston and we're a rural area, an urban area, excuse me, that we needed more gender affirming providers in this area. And so what we ended up doing is a year ago this month, we opened up our gender affirming hormone therapy visits. And since that time, we have had 72 unique patients join our clinic, and we've had over 200 individualized gender affirming care visits. Essentially, the other services that we provide is full scope GYN. We provide sexually transmitted infection testing and treatment. We are opening a harm reduction program that's going to have safe use supplies and wound care on October 2nd. We have our LGBTQIA plus health program. We do HIV testing, and we do HIV prevention with PrEP. Chest and breast cancer screenings. We do referrals to mental health. We do some basic primary care here. And again, everything that we're doing is based on inclusive and non-biased patient-centered care And Ash was talking about how oftentimes trans folks aren't getting preventative care because they don't feel safe going into clinics. And we're hoping that we are continuing to create this as a safe space because we have all the preventative care here. We can do breast and chest exams. We can do pap smears. We can do it also in a trauma-informed manner, like allowing folks to, encouraging folks to place their own speculums and get to know their own bodies, and using correct pronouns, and also using the language that the clients use to express their own bodies are just some ways that we hopefully are making this more inclusive, non-biased, non-judgmental, and just a safe, patient-centered environment. That's really all I have for now. So I'm going to let Allie talk about what she does and where we're going forward from here.
Thank you, Danielle. I am really honored to have this unique opportunity to be the LGBTQIA plus health coordinator. Things that I do in my position are facilitating communication between patients and our healthcare team, collecting feedback. We put out a survey this past June for Pride Month, and we received 317 responses. Of those, kind of the gaps that we see or the LGBTQIA plus community that they're really seeking is mental health, inclusive shelters, and supportive groups or community events. We're currently sifting through all of that information, and we'll be, trying to help create more resources with healthcare, self-care, and safety. One of the unique aspects of this position is finding staff education, also linking patients to resources and referrals. If some patients have anxiety about calling or, want me to call different places, what I'll do is call to do pre-authorizations for medications or, scheduling appointments for them. Also navigating and managing non-clinical issues within the healthcare setting. And helping provide assistance to our trans and non-binary patients navigating the medical system and supportive services related to that. So I've been gathering resources with different organizations like West Virginia Free, like Branches Domestic Violence Shelter, Contact Rape Crisis Center. If there's an LGBTQ veteran that's been dishonorably discharged, if they need that information to upgrade their status to receive the health insurance that they deserve. So we also recently just did a name change informational where we had folks from the community come in. We had Mandy Hurley from the Title IX office at Marshall University walk through steps of how to get your name changed or your gender marker. So what we want to do is have all that information in our office for any folks, whether they're patients or just LGBTQ community that want those resources to have that. And one of the things that we've been hearing a theme is just that the community wants more safe spaces. I'm safe to endorse, the WHCWV to be that safe space. Danielle's been wonderful. She's a great listener. She's an amazing ally to the community. All of our staff are amazing allies, and it's wonderful to work at a place where you feel safe and such a welcoming environment. So I encourage any LGBTQ folks that are seeking healthcare for anything or just wanting to chit chat. I'm the chit chatter, I feel, to come and talk to us and get those resources. So you can follow us on social media at Women's Health WV. We've been working on some TikToks. We have Instagram, we have Facebook. So I really encourage folks to get out there and check out our TikTok. It's been pretty awesome. You can call us directly and ask us questions anytime. So as I'm a chit chatter, I'm going to for a second. And if anybody has any questions, please feel free to ask.
And I'm just going to pop back in here and just let folks know that for our gender affirming hormone therapy visits, we are based in an informed consent model based out of Fenway Health. So we do not require letters of diagnosis from a mental health provider. And we do pretty close interval follow-ups for the first year, but we also want to bear in mind barriers to care. So we are very flexible in supporting the kind of care and the visits that fit best for the individual.
Thank you for that, ladies. I do not see any comments in the chat at this point or questions, just a lot of thank yous for the excellent information and support that you provide to the community. Again, thank you on behalf of the populations that we serve with West Virginia Free, but also as my organization at Putnam Pride, we know that this is incredibly valuable and needed, and just thank you to both of you and to your whole team there at West Virginia Women's Clinic. So let's see. Didn't know I was going to become a producer when I took on this role, so please bear with me for all the technical challenges that come with this. Going to introduce our very next guest. Let me get y'all situated here. We have, hopefully there's not typos here, Sarah Hutson, the community organizer for Planned Parenthood of the South Atlantic. And she is going to be talking to us about some of the services that they offer, both online, telehealth, and in Vienna.
Yes, thank you so much, everyone.
Sorry.
My back. That's okay.
You're back.
Yeah, so I get a full hour to talk about this, right? Since everybody finished.
Yeah, because everybody sped through their stuff. It's just yours. You know, we could go on.
No, I really appreciate y'all having us. Always excited to talk about the healthcare that we offer, both in Vienna and, as you were saying, via telehealth. And I am, as she said, Sarah Hutson, with the community organizer. And you may have gathered that means I do not work at the health center. So I'll do my best to answer any questions if anyone has any regarding the services that we have. But yeah, my role is community organizing. And if you have questions, I'm absolutely going to direct people to reach out to our folks at Vienna. They are incredible. Yeah, if you wouldn't mind going to the next slide. What the heck do we offer in Vienna and via telehealth? So Planned Parenthood in Vienna is proud to offer abortion referrals. So as I think everyone mentioned, abortion is basically banned at this time in West Virginia. However, you can call the Vienna office or set up an online appointment, and they can work you through how to travel to get an abortion. You can also email the patient navigation team. So that's patnav@ppsat.org. That is a great team of folks. All you have to do is email as much or as little information as you want. It's a secure email, and say that you need help getting an abortion, and they will get you everything that you need, whatever that may be. So if you need transportation, they'll figure that out for you. Funding resources. The main thing that I hope everyone takes away from this, or the thing that I hope everybody is screaming and shouting, is that people in West Virginia are absolutely still getting abortions. It is absolutely possible. We want to make sure that everybody is able to get an abortion when they want or need one. So for any of that, you can always email patnav@ppsat.org, and someone will get back to you ASAP and help you navigate what that means and how it's going to look for you. Birth control, again, you can go to Vienna or you can do it via telehealth. HIV services, there's rapid testing available in Vienna, and also PrEP. There's also a few other options for that there in Vienna. Some primary care services. So as Ash was mentioning, and as the Women's Health Center folks also mentioned, it's can be very difficult, but we do have some primary care services available in Vienna, and emergency contraception. So if you are near the Vienna clinic, you can get that. If you also call, they can direct you on how to access emergency contraception wherever you are in the state. If you are in Morgantown, Ash also mentioned this, we have Plan B available as well. So if you contact me or Ash, we will help you get Plan B, even if you just want to have a few on hand. Pregnancy testing. There's a star on this one. It's because it's not available via telehealth. I know you'd think in today's world we would have a way to do that, but unfortunately, if you do want pregnancy testing services, you would need to come in to the Vienna office for those. But other services are available if you are pregnant. There's a lot of stuff that you can get in Vienna. And if you don't, Vienna is near Parkersburg. If I feel like a lot of people don't know that, but Vienna is like the silent Parkersburg bestie. So if you are in that area, that's the place to go. STD testing, treatment, and vaccines. We do it all. Of course, the big one, gender affirming hormone therapy. Isabella mentioned some of the legislation that's come out and that will be going into effect in January. We are, our legal team is still looking into this. We're still figuring out exactly how this will impact our services, both in Vienna and via telehealth. For now, if you are a minor or you know a minor that is in need of gender affirming hormone therapy, please call. It's all on a case-by-case basis. But if you have any questions, again, please call the Vienna office. Our folks there are super knowledgeable and they'll be able to help you figure out what you need to do. And that number is right there, 304-295-3331. So yeah, it's a lot, right? I feel like I just word vomited on everybody, but we have a lot of services that we offer in Vienna, again, and via telehealth. So a lot of folks have mentioned there's not a lot of options for rural folks. There's one, at least there's more than one, but there's also Planned Parenthood in Vienna getting you the telehealth that you need. The other piece of this, that's Vienna. Again, that is close to the border of Ohio anyway. We also have offices in Pennsylvania, just in Pittsburgh, not far from the North Central folks. There's also a Maryland office. There are offices in Virginia all along. So if there's a good chance if you can't get what you need here in Vienna, we can help you get what you need across the border. So that's it. Okay, so more about Vienna. Where the heck is it? It's at 522 Grand Central Avenue. So the hours are Mondays, Tuesdays, and Wednesdays. You can see right there. The thing is, that's also the hours for the telehealth. So you can see there are like some evening hours on here. It is 3 days a week. But there's often same day appointments available. So don't feel like it's something, if it is a Monday, Tuesday, or Wednesday, absolutely call if you need an appointment, or again, just have questions on how to get the care that you need. You can also book online. I personally hate calling people. You don't have to if you don't want to. You can book online and make an appointment. You can book online to have that call, and a provider will reach out to you. And again, you can do that even for a same day appointment. So absolutely feel free to use that service, or at least to look and see what options there are. Once again, I want to just point out, call. That's the number again, 304-295-3331. And that's Vienna. So maybe you're on here, you need an abortion, or you know someone that needs an abortion, or you just want to put this information in your head. Again, people in West Virginia are absolutely able to get abortions across the border. Maybe you need help getting an appointment. You're not sure what your options are for how far along you are. Funding sources, transportation, anything, practical support, whatever you need. Please, patnav@ppsat.org. They're able to hook you up with whatever you need. It's a really great resource, and they're really great folks that are committed to making sure everyone has the care that they need. Again, I think one thing that you might be thinking that I want to make sure we debunk is that those navigators are only going to help you access care at a Planned Parenthood, which is absolutely not true. For a lot of folks, a Planned Parenthood is not the closest place. It's not the easiest place. And depending on how far along someone is, it may not be an option at all. So those navigators are going to help you get the care that you need, no matter what, even if it's not at a Planned Parenthood, as it often isn't. And that's fine. So once again, one last plug, please email patnab@ppsat.org. Pass it out to everybody. Let everybody know. They can always email patnab@ppsat.org to get access to a navigator. And again, the folks in Vienna are also able and willing to do that work. So you can call Vienna. The folks there, again, are amazing. And they've been there a good long while. They know what all the rules are. They're very well aware of all the resources. And their number is still right there. And they can hook you up. So essentially, if you take anything from this, it's that you can email patnab@ppsat.org to get access to a patient navigator. And if you have any questions, are you able to get the care that you need in Vienna or telehealth, whatever the case may be, 304-295-3331 for those people. And I know I said I would take an hour, but I did not. So you're welcome.
It would be hard to take an hour. It would be hard, even for people with the biggest presentations. That would be.
Don't threaten me with a good time, Sarah.
Already did. So I'm going to bring everybody back up here and introduce to viewers who might be new to us our amazing outreach organizer here at West Virginia Free, Hannah McCoy. First, on behalf of everyone here at West Virginia Free, I want to take a look, make sure we don't have any questions in the comments, which I don't see any at this time, but if you have them, feel free to drop them. I'd like to thank, this whole week has been filled with some really great presentations. On Monday, we had our partners and friends from the perinatal partnership and West Virginia's DHHR family planning. We talked about contraception access, where you can go within the state to get resources that you need. We talked about teen pregnancy and the need for resources across the state to impact the lives of our youth. On Tuesday, we talked about comprehensive pregnancy options trainings that we do here at West Virginia Free with Dr. Yvonne Lee Long. We kind of did a demonstration there. So if you have questions about what that training might look like for you, your team, your colleagues, please feel free to go back to that video and take a peek. Wednesday, we had a conversation about our self-managed abortion training that Hannah leads here in the state. We had our special guest, Susan Yano from Women Help Women in SAS. We also had our executive director, Margaret Chapman Pompano, on to talk about the policy that has shaped access and lack thereof to abortion care here in the state of West Virginia. Yesterday, we had a great panel discussion with our friends Danielle Walker, Rhonda Ragambe, and Vanna Riddle, and we talked about Black infant and maternal mortality in the state and in the nation. It was a very, very hard conversation, but one that desperately needs your attention. So if you did not watch that video, we please ask you to go back to it, let that sit in, and then see some calls to action that we have here in our state to help address this issue. And again, thank you so much to our panelists today, Isabella Cortez, Danielle Maness, Allie Layman, Sarah Hutson, and Ash Orr. This has been a great week, and we thank you so much for your time and your energy and your support. If you would like to continue your support to West Virginia Free, we would welcome your donations of time, talent, and treasure. So whether that's your energy as a volunteer, your knowledge, like all of our panelists here, or your financial support to the work that we do here. You can also visit our Linktree to learn more about all of the wonderful things that we're doing, the trainings that we're hosting for our self-managed abortion, safe and supported, throughout the state, in person and virtually. And as we have done all week, we're going to close this session out with a mindfulness activity because we acknowledge that the work that we do in this space is hard and it's heavy, and it requires us to not only look out, but look in and make sure we're taking care of ourselves, because without fully embracing our own needs and recognizing them, we can't continue to carry the work to where we know it needs to be. So Hannah.
Thank you, Sarah. I'm so glad to see everybody here. It's been such an amazing week, and Margaret put this in the Facebook comments, but I just want to really shout it out. Let's give it up for Miss Sarah Harris, West Virginia Free's Director of Programs, for being our MC all week, for working so hard to put this together. It has really just come together beautifully, and we can't thank you enough, Sarah. You deserve a shout out too. All the shout outs you've been giving. Pat yourself on the back a little bit. But so today's self-care exercise will look a little bit different, just where we don't know who's tuning in from what area, but we've got to really hit on a lot of great topics this week. We've got to talk about how we view ourselves versus how we view the world around us. We got to talk about carrying the weight of our own and others' experiences. We talked a little bit about grounding when things feel really overwhelming, how we bring ourselves back. And we also got to talk a little bit, or listen, really. We had our listening ears on yesterday to listen about intergenerational trauma. And today I want to talk about self-care and social media, particularly based around a lot of the things that we've seen in media and heard today around LGBTQIA harm and hate that we've seen from legislators, from people on the internet. It's hard, we see it constantly. And I think sometimes it's very easy to say, well, just get off social media. But if you're a person in my shoes, or in a lot of shoes of people on this call, social media is a big part of your job. I don't get a choice to stay off social media. We're all on social media right now, tuning in of some sort to stay in the know. So today I'm going to present you with a little exercise that I invite everybody to do, probably largely on their own time, because I can imagine lots of people who are probably watching on their phone, so may not have the availability to do this. But I want everybody to take some time later today after this call, when you have a moment, when you have the brain space, and pick any social media app you may choose. It could be Twitter X, it could be TikTok, it could be Facebook, Instagram. I feel like I am a young professional and new social media apps come out like every other week. So any social media app you may choose that is curated to what you like. And take some time to note what your first 5 posts on your feed are. Are they posts from family? Are they posts from friends? Are they memes? Pictures from organizations that you like? Is it a news article? Is it something that a social media platform has sponsored or showed you into your feed based on because they would like it? Take note of what these 5 posts are, and you don't have to do this literally, but if we could put them all side by side, what are the feelings that they give us when we see these posts? Really take some time to think about, what emotions are you getting from the things that are on your direct feed every day? I know sometimes I open my phone and the first thing I could be would be a picture of my little brother. It makes me so happy. And the next article is something horrible that's happening within my state, outside of my state, and it just makes me angry and heartbroken. And the next thing could be a recipe that I've never seen and I wanted to try, and it makes me hungry and feeling creative. Really take some time to intentionally look at, what are the things that I'm consuming and what are the feelings that they're giving me. What this does is it allows us to take an intentional inventory of what we're consuming. Social media is built into so much of our lives, and as much as we would like to all turn it off, it's not always a reality to completely turn it off. But what we can do is do the best that we can to intake good information, but also ensure that we're protecting ourselves and our peace so that we're not seeing only things that are harmful to us. I will say that Twitter X, I love Twitter. And Twitter is hard for me sometimes. A lot of people that I follow due to organizing or activism or folk reporting, all of those things take place on Twitter. But sometimes it's really hard for me to scroll on Twitter leisurely because there's so many things that are going on. I can't relax my brain. It pulls a lot of emotions out of me that I don't always have to spare. So I invite everybody to take a little time and really notice what it is that you're seeing recurring on your social media, and take some time to see, maybe there are a couple accounts that I need to like snooze for a couple days. Maybe there's a topic that I keep seeing that I just can't look at right now this second, but I can come back to it a little later. And that's my exercise for everyone. I want everybody to take care of their brains. As I said, I'm Hannah, I'm the outreach organizer, and I'm so happy to have had this week with everybody.
Thank you, Hannah. That's particularly hard for us as we look at January in the legislature. I say that's probably for me the very hardest time to figure out that separation. And I'm sure for many of us over the past few years, watching what's happening, that's probably true for you all too. So, well, thank you guys again. Please, take the time to go back and watch some of those videos. Please go to all of the resource pages that are shared with you over this week. Support your local abortion funds wherever you are. And thank you so much for your time. We'll see you guys next year.